Good morning, good afternoon, everyone. My name is Olivia Law-Davies. I'm the Regional Communications Manager for WHO here in the Western Pacific region. We're delighted that you've joined us in the room and online for this media briefing today, which is going to focus on the 75th session of the WHO Regional Committee for the Western Pacific, taking place here in Manila at the regional office next week. And in addition, we're launching a new report on how the Sustainable Development Goals related to health are tracking in the member states of the Western Pacific region. In a moment, I will introduce all of the other people that are here in the room, but for now, I'd just like to hand over to our Regional Director, Dr. Saya Mau Piokala, who is going to give some opening remarks. Thanks very much.
Good morning, good afternoon, and a warm welcome to our channelists here this morning in Manila and those of you joining online. Thank you for joining us for this press conference. Today we are here to launch a new report looking at how the Western Pacific is tracking on the health-related Sustainable Development Goals and to preview the expected outcomes of the WHO Regional Committee meeting for the Western Pacific taking place here next week. This will be my first Regional Committee meeting since taking up the role of Regional Director in February. It is both a privilege and a great responsibility to lead WHO's work in this vast and dynamic region. I'm looking forward to having important dialogues with ministers, senior officials, and partners on key health challenges and how we can work together to address them. But first, let me share a few highlights of the report I mentioned. As you may know, the world leaders came together at the UN in 2015 and agreed on a set of global goals to be achieved by 2030. Among them are targets to improve health and well-being. The report we are releasing today looks at how countries in this region are tracking. It finds that there has been some impressive progress, but also points to a number of areas where urgent action is needed to meet the goals by the deadline, just 6 years from now. In terms of life expectancy, the report shows that COVID-19 did less damage in the Western Pacific than other parts of the world. Life expectancy is now 77 years, longer than any other region of the world. But it's not all positive. The pandemic, of course, caused devastating losses of loved ones, and it disrupted progress in various other areas of health. It also deepened inequalities. The report points to major challenges in the region in terms of climate and environment-related health concerns, planning for rapid population aging, tackling non-communicable diseases like heart disease, stroke, diabetes, and cancer, and ensuring people can access the health services they need where and when they need them without any financial hardship. We urgently need transformative primary health care, robust systems for health financing to achieve universal health coverage and the SDGs, as well as digital health, climate-resilient health facilities, and many more. And this brings me to the business of the Regional Committee meeting taking place here next week. It is WHO's most important governing body in the region. Once a year, health ministers and other senior officials come together to decide on key priorities. In my main address, I will share an update on WHO's recent work in the region. Then I will present a new vision for improving health and well-being over the coming 5 years. The vision centers on the analogy of weaving a mat, a traditional activity across Asia and the Pacific. It symbolizes the collaborative efforts needed by WHO, governments, and partners. across 5 vertical and 3 horizontal strands during the period 2025-2029. The vertical strands of action, led by government working with WHO and other stakeholders, are focused on transformative primary healthcare for universal health coverage, climate resilient health systems, resilient communities, societies, and systems for health security, healthier people throughout the life course, and technology and innovation for future health equity. The horizontal strands of action by WHO are to ensure that our country offices are equipped with skills for scaling up and innovation. There are nimble support teams in the regional office, and we use communication effectively for public health. Also, at the regional committee meeting, member states will consider action framework to address 2 important health challenges. First is a regional action framework for health financing to achieve universal health coverage and sustainable development in the Western Pacific. Despite recent reforms, we don't yet have the policies and public health financing needed to ensure equitable access to essential services in the region. Many families are struggling to pay for medicine and doctor's visits, and they are falling into poverty. In 2019 alone, more than 300 million people in the Western Pacific faced catastrophic health costs. To achieve universal health coverage and sustainable development, we need more government spending on public health, prioritizing primary health care. The draft framework that member states will consider next week aims to help them improve health financing by ensuring greater reliance on public funding for health, more equitable and efficient health spending, financing primary health care now and into the future, strengthening governance for health financing, and promoting health for all in economic and social policy. Member states will also consider a regional action framework on digital health in the Western Pacific. As the use of digital technology to improve health continues to grow rapidly in our region, the need for better governance and legislation, standards, and workforce capacity are becoming more important. The draft framework that member states will consider focus on 5 areas: governance, social, technical infrastructure, financing and economics, digital health solution, and data. In addition to the regional action frameworks I have described, delegates will engage in panel discussions on climate resilient healthcare facilities, transformative primary healthcare, and oral health. In addition, they will review progress on issues such as health security, including antimicrobial resistance, non-communicable diseases and aging, climate change, environment and health, and reaching the unreached. There will be a special event on the first ever WHO investment round, where we expect governments and partners to pledge new support for our work to improve health in the region. There will be side events on topics including oral health and tobacco control. In another phase, we will unveil a series of 6 exhibitions showcasing important health issues facing our region. And these include the future of health, strengthening health emergency response capacities, climate resilience and environmentally sustainable healthcare facilities, the dangers of new and emerging tobacco and nicotine products, health equity, and reaching the unreached. As you have heard, there's a full agenda next week, but I want to ensure that we have enough time for questions and answers. And as you can see this morning, I'm joined here today by our directors of our technical division in front of us, as well as the WHO representative to the Philippines. They are here to answer any questions health-related in our region. And I thank you for joining us this morning. And we would be happy to take your questions now. Thank you.
Thank you so much, Dr. Fiucala. And thanks everyone who has joined us so far online and in the room. As Dr. Fiucala mentioned, we have our directors for the WHO Western Pacific region, both here in the room as well as one online. I'll just introduce them to you quickly so that you know who we have in case you have any questions for them. So we've got Dr. Tomas Landes, who's the Director of Administration and Finance, Dr. Luis Finals-Torres, Health Systems and Services, Gina Saman, Health Emergencies, Susan Mercado, Program Management, Huang Tran, Programs for Disease Control. Of course, Dr. Rui Paulo de Jesus, who's the representative to the Philippines, Dr. Hiromasa Akayasu, Healthy Environments and Populations, Dr. Kidong Park, Data Strategy and Innovation. And online, we have Dr. Mark Jacobs, who is based in Fiji, who is our head of Fiji Country Office, as well as being the Director for Pacific Technical Support. Thanks so much, everyone who has joined us. So if you have questions either on what's coming up at the Regional Committee next week, on the new report that we're just launching today, or indeed on any other health issues that could be of interest to you and your readers and listeners, please raise your hand here in the room, or if you're connected online, raise your virtual hand, and we will try to get to your questions one by one. We ask that you start by introducing yourself, just your name and your outlet, so that we know who we're responding to and can make sure that we're giving the most relevant information. And so we've got a couple of colleagues in the room who are helping with roving mics, I think. So anyone either here in the room or online who has a question for us, just let us know now. Thanks. Okay, I can see one online. We've got Arik John Sikua from Manila Times. Go ahead, Arik. If you want to ask your question, we can unmute you.
Yes, good morning. In the report that's going to be released today, what specific information for the Philippines is in the World Health Organization's report?
Thanks so much, Arik. It's a super, super rich report with many, many different areas of data, but perhaps we can bring a microphone to Dr. Rui to give some of the highlights of the findings for the Philippines to begin with.
I think what we'd like to emphasize what is going on in the Philippines prior to the the Regional Committee meeting. A few highlights here that I would say the success stories that probably we'd like to share here. Number one is that the efforts or the investment of the government of the Philippines through the Department of Health to increase access. As you know, this is to address the issues of barriers for accessing healthcare service to public health, including here the geographical barriers. As you know, with I think you are aware of what government is doing at the moment, that is to introduce, or this is not completely new, but what we call bukas centers, right? That is bagong urgent care and ambulatory services, right? With that, the bukas center, they operate beyond the normal working hours. Therefore, the workforce of the Philippines, they can access healthcare services after the working hours, right? And also, that's number one in strengthening or improving access to the healthcare services. And secondly, the other initiative of the government is trying to bring the healthcare service closer to the community, including ensuring access for the healthcare services by the indigenous people. Recently, we started a program on TB, which we focus on screening the TB among the indigenous people. Although this is the beginning, but definitely government will support to expand the program to other people in the remote areas as well. I would also like to, probably your concern is about the immunization. I would like to share the good news here is that in last April, in collaboration between WHO, other agencies, of course, to support the government in addressing the measles outbreak in BAM, of which, with a lot of difficulties, we are able to achieve a very high coverage, that is more than 80% coverage of children from 6 months to below 10 years old. So these are few things that probably we would like to highlight for the Philippines at the moment. And also your concern about the immunization, including availability of vaccine. Recently, 3 million doses of pentavalent vaccine have arrived in the country and has been distributed to the whole of the country, and the immunization program has resumed its speed. And also one more thing on immunization, that in strong collaboration with the Department of Education, government has started a campaign for a new vaccine, not completely new, but intensified vaccination for the HPV, for the prevention of cervical cancer. This is ongoing, and I think this week it's in Bicol area, and will be I think it's simultaneously in other provinces as well. I think for the time being, let me just list this for your information, and many more information maybe you can share later on. Thank you.
Thank you.
Thanks so much, Eric, and thanks, Rui. I think we need a microphone from Mikael Flores from Reuters here in the room. If one of my colleagues could bring you a mic, Mikael.
Thank you. Good morning. Dr. Piocala, in the report, it mentions that the Western Pacific region is not on track to meet the SDG targets, particularly for NCDs. We'd like to ask, how likely are we going to hit or miss the target on NCDs, considering that we're just 6 years away from the end of the goals? I understand that the reporting period for the report is from 2000 to 2021. So I wonder if there's any progress made since then, particularly on NCDs.
Thanks so much, Mikael. We might actually ask Dr. Kidong Park to give a first few remarks on that, because he and his team have actually led the work on this report and he really knows it in detail. Over to you, Kidong.
Thank you for your questions. Regarding the progress in the NCD, so we monitor the proportion of the premature mortality due to NCD. So we observed that since 2000 and then 2021, there was decrease about 25% of the premature mortality of NCD. However, with this speed, we anticipate we cannot meet 2030 deadline, which we want to reduce by 1/3. And then there are many risk factors causing the NCDs. I want to mention two things. One is alcohol consumption. Second one is tobacco consumption. Alcohol consumptions in this region rose about 40% from 2000 and 2015. Good news is after that, we see decrease. However, there's a long way to go. And then the tobacco consumption, we see decrease. However, the withdrawal rate is higher than global average. So we need to decrease alcohol consumption. We need no more quit tobacco consumption, and that will reflect in the reduction in the premature mortality due to NCD.
Follow up, if I may.
Sure, go ahead, Mikael.
On the tobacco use, yeah, it was indeed mentioned in the report that the prevalence is in the Western Pacific is higher than the global average. What policy prescriptions is WHO recommending in terms of ramping up the reduction of the use of tobacco? What are the constraints that you're seeing in the region in terms of policy? That's why we're seeing a higher than usual, a rate that's higher than the global average.
Thanks, Mikael. I might ask Kirong to hand the microphone to his neighbor, Dr. Hiromasa Okayasu, who's our Healthy Populations Director.
Thank you very much for excellent questions. So as you may be aware, the WHO has published a series of recommended policies, what we call the NCD best buys. For tobacco, there are a few recommended actions, such as increasing the taxes for tobacco, and then restrict the marketing, and then provide access to cessation, and then others. So if you look at our region's situation, so some countries are quite progressed. And as you can see, that in this country, for instance, like it's very difficult to see the people smoking in public space or inside the office. And then tobacco price has been increasing. That's happening in general. And at the same time, if you look at the different countries, the implementation has been varied. So for us, it is very important to make sure that all countries implement what we know as the best buy policies that's effective in reducing the tobacco consumptions. Second one is like we are really concerned about the emergence of a new technology, and then particularly like what we call the e-cigarette, electronic cigarette. And then in some countries, this is not considered to be a tobacco products or even medical products, and then regulation is quite loose. And then we are really encouraging our member states to be aware the potential harm of these new products, and then start sort of including them in the regulation or ban it if possible. Thank you very much.
Thanks so much, Hiro. We have a question online, a couple in fact. I'm going to first invite JV Valayera from Pacific Islands Times to unmute and ask a question. Go ahead, JV.
Yes, good morning. The Western Pacific covers 3 U.S. territories that includes Guam, American Samoa, and the Northern Mariana Islands. And these places have really high non-communicable diseases rates. So in terms of WHO, is it working directly with the individual governments of these territories or with the U.S. government itself?
Thanks so much for your question, JV. Let's try and go to Mark Jacobs, our Director of Pacific Technical Support, to see if he can have a go at answering that one for you. I know his internet connection is maybe not super strong, but let's give it a go.
Yes, hi, it's Mark Jacobs here. I've just turned off my camera because my connection's a bit fragile at the moment. But thank you very much, excuse me, for the question. Certainly WHO, we work directly with the governments and the authorities in all of the different countries and territories and areas in our region. Although we also work, of course, with US government partners as well, but our principal points of contact are the local administrations in the Pacific. And so for the three places that you mentioned, Guam, American Samoa, and Confederation of Northern Mariana Islands, we have focal points for all three of those. American Samoa, their primary relationship is with our office in Samoa. And as for Guam and Northern Marianas, we have focal points here in the Fiji office that work directly with those countries on the range of different public health issues and challenges that they're facing.
Thank you very much.
Thank you, JV, and thanks, Mark. I see another question online, which I'm going to take because I can't see any other hands in the room right at the moment. Samantha Magic from Islands Business in Fiji, go ahead and unmute yourself. Or if maybe we've got a bandwidth challenge, I can ask Samantha's question on her behalf. She dropped it in the chat. So her question is about an emerging health issue, mental health support services, particularly for drug rehabilitation and supporting people struggling with addiction. How is WHO supporting Pacific Island governments to address this issue? What can be done in countries and where there are almost no mental health support structures in place? And what can we learn from our neighbours and countries that have been dealing with this issue for much longer? Let's see if, I don't know if Mark, you want to give some reflections on this one as well, and perhaps we can also ask Hero here in the room whether he wants to add anything. Over to you, Mark.
Yeah, it's cool.
Not sure if we've got Mark's connection working at the moment, but my apologies. I should have invited Dr. Huang Tran to respond here in the room. Over to you, Huang.
Thank you very much for the question. So for your information, 2 years ago, at the regional committee meeting in Manila, the regional committee have endorsed the regional framework for future mental health, which focused on refocusing on the mental health services and embedding the mental health services in the social life and retransforming the mental health services. So with this, the new framework, the member state committed to address the mental health issues, and of course, the Pacific Island countries also committed to address the mental health issue. One of the biggest challenges in our region is that we have the high suicide rate as compared with other parts of the world, and we have more than 200 million people people suffering from different mental health conditions, including the drug addiction. And the WHO is working closely with member states, especially in the Pacific. We also have a Pacific Mental Health Network, which is working closely with the regional office to address on the mental health issue in the sub-region in the Pacific Island countries. We are also providing the support to countries like Palau, Micronesia, and other countries in the and areas in the Pacific Islands to address the issue of suicide rate. And here in the Asia, also in the other part of this region, we also having some countries which are very rich experience on addressing the mental health issue, like including Australia, New Zealand, Japan, Korea, who are supporting other countries to the WHO Collaborating Center to address the mental health issue. So thank you for the question, and I hope I respond to the answer to question. Thank you.
Thank you so much, Dr. Huang, and apologies for misdirecting the question earlier. I can see a couple more in the room, so let's get microphones over to our colleague here on my right. Thank you.
Hi, I'm Casey. I'm from Rappler. The report noted that climate and environment-related health concerns are still a major challenge for Western Pacific countries. I was wondering if the WHO has specific programs, and for the Philippines specifically, are you working with the government, for example, I guess working on active transportation options, or and what are the challenges in bringing about these programs to life?
Thanks so much for the question, Casey. I'm going to point the microphone in this general direction, see if Rui wants to give a few remarks and perhaps be complemented by other colleagues.
Once again, thank you so much for the question. Yes, I think, as you know, climate change and health has become a hot topic in WHO and in overall the health fraternity. we as WHO, definitely we work with the government to develop pertinent policies to how we can mitigate the impact of the climate change in the country. Few examples or initiative in our collaboration, it tried to introduce renewable energy. We install renewable energy, that is the solar power, in a number of health facilities in the country. And we follow up with that, and we the report from those health facilities that of course, that is intentionally to also mitigate the impact of climate change, but also financial benefit from that. All of those facilities that we installed the solar power, they reported back to us that they are able to save up to or more than 50% of their electricity bills, right? And also we work with the government to look at how we can improve the wash and health, wash including water and sanitation in health facilities in the country. Additionally, definitely we look at how to strengthen our collaboration to address diseases pertinent to this, floods and so on, including dengue, malaria, and so on. So these are few things about the examples of our collaboration with Department of Health and of course the government of Philippines, from policy to the practical implementation in the field, of which the result of which, as I just shared earlier. So thank you so much.
Thank you, Roy. I just want to add on, I think this is one of the priority of WHO is the impact of climate change on health. I think there are different health issues in Asian countries and small island developing states. But what is important for us here in the region to change the narrative, the impact of climate on health. And the concern of WHO is building climate resilient health system. Last year, there was a survey done in the Pacific, 14 Pacific Island countries, 74 hospitals, and 62% of those hospitals were within 500 meters to the lake, to the river, and to the sea. So putting them at risk of flooding and inundation. So what is important for us now, we've got the ACE Center in Korea, and I think I will ask Susan to talk more about ACE. But what is our priority now is to build and strengthen climate resilient healthcare facilities. Susan?
Thank you very much, RD. The sea level rise in the region is very high. Philippines, for example, has sea level rise that's 3 to 4 times that of global sea level rise. And for the Pacific, it's similar. We have, I think, more than 2,000 islands all over the region that are vulnerable to sea level rise. And I'm zeroing in on sea level rise because it is one of the very peculiar issues for the Pacific and for all of the region. It's estimated, for example, in the Philippines that 70% of communities are in coastal areas. And for the Pacific, it's 100%. People living within 100 meters of a coast. The destruction of the ocean and the destruction of mangroves has made it very difficult for islands to continue to sustain good ecological systems. And so we have a very special center at the in Seoul, Korea, which is supported by the Ministry of Environment of Korea and the Seoul Metropolitan Government. That center, called the Asia Pacific Center for Environment and Health, is doing a closer, it's doing closer work on the international ramifications of climate issues, particularly sea level rise, and looking also at inter-country problems in relation to the environment. We are, as RD has mentioned, the key thing is climate resilient health systems. And for small island countries and other parts of the region where economies of scale are not there. So for example, the Philippines can order solar panels because they would order it in bulk. But if we're looking at Kiribati or we're looking at Tuvalu, they cannot order at a good price those kinds of things, solar panels, desalination plants for water, rainwater collecting systems. So currently we have a team of experts that are looking at what are the opportunities for all member states to improve their healthcare systems and to make all healthcare systems climate safe and resilient. Now, having said that, just on a final point, we don't know what the figures are for the region, but globally, 40%, only 40% of primary healthcare centers have running water. So it means that when we think about improving the climate resilience, we have to look at the most basic things like water and sanitation. Thank you.
Thank you so much, Susie. I know we have more questions in the room, but we also have a couple questions online. So with your patience, we'll just first go to them. We've got Dec Villanueva with the Philippine Star online who has a question about Mpox. Go ahead, Dec.
Yes, good morning. For Dr. Ruby Paulo de Jesus, sir, I'm just interested if we have sort of an assessment or update as to the Mpox cases in the Philippines. Last report from the Department of Health noted it recorded 18 Mpox cases, all being clade 2 variant. Is there available information of additional cases? And at this point, can we say that the Philippines is now safe from Mpox?
Perhaps we can give Rui an opportunity to say a few things, and also Gina, our head of health security and emergencies in the region.
Okay, thank you. As of today's what? 10th of October, the number of Mpox cases in the Philippines is 24, all clade 2 and no death.
Should we hand over to Gina for some more remarks on Mpox in the region and globally?
Thank you for the question. So with Mpox globally, the situation, WHO is carefully watching and responding to the situation, especially in the African region, where the clade 1b has been detected in Eastern DRC in recent months. And so countries globally are monitoring the situation, responding to outbreaks, emphasizing surveillance and response measures to quickly detect, respond, and prevent further transmission of cases. In our region, we've had since 2022, 4,500 cases, not of clade 1b, but of clade 2 detected, including in the Philippines. And so the global strategy is to quickly detect, quickly respond, isolate cases to prevent further spread, and of course, increase our capacities in health service provision and community engagement to inform communities of the risks and to seek early care and treatment and diagnoses. This is helpful to stop the further spread and keep our families and loved ones safe. In the Philippines as well, to complement the strategic plan outlines a variety of scenarios to help respond in the different pillars, and WHO is working closely with the Philippines and all governments in the region on those capacities so that the response remains flexible and agile as the situation evolves, and always watching what happens outside our region. Thank you.
Can I go back to Dr. Ruby? The follow-up question, I have a follow-up question as to, can we say or can we declare now that the Philippines is safe from Mpox at this point?
I mean,
so far, what is our assessment of the Mpox cases in in the Philippines?
I don't think we can declare a country is completely safe for such communicable diseases, right? But I think we need to take note is the efforts how to contain the disease, right? What happens now is, I think that for your information, there is no, how to say, in-country transmission. Those cases are independent cases, and most of the cases are under investigation, right? The government is working very hard to contain these cases. And as I informed earlier, there is no death case reported in this country. We continue to improve the capacity to prevent, to detect, and also to treat the cases in the country. I hope I answered.
It would be better to just follow, continuously follow the national Mpox plan of the country, national Mpox plan.
Yes, I think we're good. We've got another question, another here in the room. If colleagues could please bring a microphone. Thank you so much.
Hello, good morning. I'm Ara Perez from ABS-CBN. It says in your report that previously the major causes of death in the region are infectious diseases and injuries, and now NCDs account for nearly 9 out of 10 deaths. May we know what happened along the way? What is the cause of this shift? And what can people do to avoid these diseases? Thank you.
Thank you, Ara. Perhaps we can start with some initial reflections from Kidong and then hand over to other colleagues.
Yes, very good questions. You are right that the region is undergoing the epidemiological shifts. That means major cause of death before it was infectious disease and then also MSH-related disease. Now it is shifting to non-communicable disease. The cause of the shift was first because of the success in the communicable disease control program, success in the immunization program, success in the maternal and the child health program. And the increase shifting to NCD, aging, and then increasing use of the tobacco, alcohol, and the environmental factors. However, as I mentioned, we focus on reducing premature deaths because due to NCD, it is decreasing, however, so we have more to go.
Please go ahead.
So just to supplement, as Dr. Kidong said, the disease burden has shifted to NCD, and then people are living longer, like everywhere in this region, which is a great news. But that means that the definition of health has been shifting as well. Previously, the health is the absence of sickness. So when you are usually sick and then get diseases and get treated and then become unhealthy again. But in the non-infectious disease world, I think it's more like a graduate, meaning like if you don't have any symptom, but if you don't have a good lifestyle, good environment, I think your health slowly deteriorates. And by the time that we realize that there is some pain or problem, usually it's a little bit too late. And then NCD is the result of a long time environment, genetic, and then behavioral factors. So health sector needs to pay attention that their role is not just to wait in the clinic and then hospitals and treating diseases, but to proactively reaching out to the healthy populations and then understand their situation and risk factors and then address these so that they don't have to come to the hospitals and then clinic. Thank you very much.
Thanks so much, Hiro. And some more reflections from, we'll keep passing it down. Go ahead, Dr. Huang.
Thank you very much for the question. And as Dr. Kidong mentioned, and Kidong mentioned earlier, that we have a very successful implementation of infectious disease control program, including immunization, TB, HIV, malaria, neglected tropical diseases, and our region is the leading region in achieving this success. However, the NCD, we see the slow progress, and as Dr. Kidong and Dr. Hiro mentioned, there are several factors, and That's why our region is working intensively to ensure that the member state can achieve our SDG target and also to achieve the regional target of reducing mortality due to NCD. And in all, beside the addressing the issue of the risk factors and also shifting from the sick system to the health system, we are also working on the transformative primary healthcare, which is embedded in the new vision that our regional director has mentioned, and to ensure that those people with the condition like hypertension, diabetes, and other NCD condition can access to the essential services at the primary care level, where they are close to their community and they can access with to the service easily. So it is also one of our focus, and we also pay attention to early detection, and that screening for NCD also very important together with other methods. Thank you.
Thanks so much, Dr. Huang. Dr. Susie, we got a microphone for you too.
Thank you very much. Just to add to what the colleagues have mentioned, NCDs have long been a leading cause of death in many countries. And I would like to refer to our vision document, which is Weaving Health for Communities, Families, Communities, and Societies, which focuses on the social determinants of health. I think because of all the changes that are happening in the world, the traditional and the cultural heritage of communities have changed. So once upon a time, if you were breastfeeding, your mother would teach you how to breastfeed. But now you have to go to somebody to teach you how to breastfeed. That's an example. So I think the disintegration or the changes in the social life of people has had a big impact. So mothers, for example, instead of cooking fresh food, will buy instant noodles and, not really have the time, or kids eating fast food, or a dependence on vehicles and not wanting to walk, or cities that do not encourage you to walk or bike. So the whole lifestyle of communities and societies have changed. Now, the key factor here are what we call commercial determinants of health. There are industries and businesses that will continue to promote products and ways of life that go against health. The more obvious ones are tobacco and alcohol, but also there is there's a trend towards consuming not just processed food, but ultra-processed food. So that the diet is no longer diverse. It does not anymore contain the necessary naturally occurring fruits and minerals and vitamins that you find in fruits and vegetables and so on. So this has been going on for 2 or 3 generations. And so we see with that the rise of obesity, and with that, so many other complications. So in our vision document, we do talk about how do you work with families, communities, and society to change all of this. Because if the mother who's cooking is able to reduce the salt, for example, in the food, the whole family will benefit from that. Or if the family decides, instead of watching television, let's go for a walk, then that is the way a family would be able to reduce the risk factors of NCDs. So I think for the vision document that we are releasing, we are looking at the social determinants of health as a positive force against some of these commercial determinants that have to be addressed through policies and regulations, because it is not all about telling people what to do. Many smokers, for example, know they shouldn't smoke, but they continue to smoke. And so we have to think about the commercial determinants, and we have to think about what kind of assets we have in families, communities, and societies to fight off the forces that are driving the NCD epidemic. Thank you.
Thanks so much, Dr. Susie. I know we have another question from Mikhail from Reuters in the room, but in the meantime, we also have another one online from JV Valera from Pacific Island Times. Go ahead, JV, unless you feel like your question was answered already.
Yeah, about the new WHO report on health statistics in the Western Pacific. Were there any surprises at all? Is there any particular part of the report that WHO would like to highlight? That's it.
Thanks, JV. Over to you, Dr. Kidong.
Yes, we have three key messages. First, the region is the longest living healthier, longest among other regions. And then in addition to this region was least affected by the COVID-19 in first 2 years in terms of the reduction in life expectancy at birth. However, NCD is rising, as we discussed a lot. The alcohol consumption, tobacco consumption, we need health lifestyle, we need to change the health system from the sick-based system to health system. Third message I want to highlight this. Our journey towards a universal health coverage, there's a mixed finding. Access to service, quality health service goes well. However, there is a great disparity between countries. Most alarming message is many people are experiencing financial hardship due to high out-of-pocket service. This is becoming worse, and that is our region is the highest regions which experiencing this kind of financial hardship. We need urgent action to address this. Maybe my colleague Luis can
Yeah.
more.
Thank you. If we could get a microphone to Luis, that would be excellent.
Thank you very much, and forgive me for my voice. Just a couple of metrics to illustrate the last point of my colleague, Dr. Kidong. In 2000, the region, we had 1 out of 10 people that were suffering financial hardship, which means that they spend more than 10% of their family income when accessing services. In 2019, this is 1 of every 5 person. So we have double the people that are suffering financial hardship. And you might ask, why is driving that? What is driving that? In almost all countries in the regions, medicines outpatient, when we go to pharmacies, particularly, it's the main cause of this financial hardship. And in our this year, and we are going to submit it to the regional committee, one of the critical areas is we really need to tackle the financial hardship linked to medicines and encourage all governments to start spending domestic resources and to develop policies via augmenting the access of medicines in public facilities or reimbursing medicines in the private pharmacy to start tackling this issue. And it's a problem that has been with us and worse for the last 20 years. Thanks.
Thank you so much, Luis. I can see 2 questions in the room. So, Mikhail, I think you had a question earlier, or are you good? Okay, Mikhail, and then we'll come to you as well. Thank you so much.
Yeah, it's okay. Yeah, related to Philippines again, Dr. Rui, because I noticed in the report that, for example, in deaths due to injuries, all countries in the Western Pacific except the Philippines were able to reduce the incidence of mortality rates. I'm wondering what is the underlying factor for that, and under the deaths due to injuries, the Philippines is also an outlier when it comes to deaths due to drowning. So what also are the reasons for those glaring statistics? Yeah.
First of all, I think I'm happy to inform you that one of the priorities of the program is priority programs of the government is road safety, right? So with that road safety, definitely through the improvement or reviewing the existing policies of road safety, including how to implementation of those policies on road safety, and of course, with that, the improvement of the services, injury services in the hospital, training of the health workers, doctors, and also the expansion of the services to more areas, or geographical distribution is much wider than before. That therefore, I think you mentioned about the reduction of that. I think that's the logical consequences of government commitment. So by saying that policy or the priorities of the government, that shows the political commitment as well as financial commitment of the government is quite high in strengthening this area.
Can I?
Yes, please go ahead here, and then we'll come to Susie as well.
So on drowning in the Philippines specifically, so as you pointed out, unfortunately there is a slight increase in drowning deaths in this country. In year 2020, something years ago, that there was 5 deaths per 100,000 populations. And in 2021, the latest statistics, it has increased to 6. So there is a slight increase. And we wanted to point out the 2 things. One is like majority or significant portion of these deaths are minors and then children. So there's a very significant tragedy there. And then I wanted to also point out that many of the adult cases are linked to alcohol. So this is also important to make sure that we have a good alcohol control. And for WHO, we've been working closely with the Department of Health and then partners such as Bloomberg to develop a plan. Most recently, we have a multi-sectoral plan on preventing drowning prevention in the Philippines 2016 to 2026. And then we are also specifically working on a couple recommendations, such as integrating the swimming and then water safety into the school curriculum. And there might be fencing and then a safeguard of water places in this country, as well as the control of the alcohol, especially close to the water area. So these are the major recommendations that we made in this action plan, and we are working with the government to implement these policies.
Thanks so much, Hiro. Over to you, Susie.
Yeah, thank you. I just want to add to, Hiro said everything already, but I just wanted to add that, as I said earlier, 70% of the Philippine population live in coastal areas. And currently, the data will show, not in our report, but outside, that about 15% of communities are already constantly underwater. So even when it's not raining, it's not flooding, which brings me back to the sea level rise issue. So as Hiro said, the drownings are mainly minors, and that's regional. So drowning among children is one of the highest causes for death, no? Among children. And when you think about all the islands and you think about the Pacific and all of that, the risk is high because the environment is changing.
Thanks so much, Susie. I know we had another question here in the room. If we can get a microphone. Thanks so much.
Good morning, everyone. I'm Bernadette Reyes from GMA Integrated News. While we understand that usually the non-communicable diseases affects those who are already aging, is there a shift? Maybe you could provide us with some data if it's also affecting the younger age group and why. Thank you.
Thanks so much, Britta. Let's start on this side of the room. Over to you, Kirong.
If you see the reports, so we are monitoring the obesity in children. Alarming, it is rapidly increasing. That will result in the NCD when they are adolescent or as young children. So this is alarming. And then also, if you read the report, we present the life expectancy as a whole, and then healthy life expectancy. There's some gap. We want to increase people's life expectancy, and then as well as a healthy life expectancy. The gap is they are low. They live, however, is with a lot of the disability, with a lot of the disease. We do our best efforts to do this. And there's a more detailed information. I think the Hero can.
Thank you very much. So, as Dr. Kido mentioned, that there is a significant difference in this region, unfortunately, in terms of life expectancy or healthy life expectancy. So if I'm understanding correctly, there's also about 20 years gap of the highest life expectancies and then countries with the lowest life expectancy. And if we analyze the difference, I think it's almost primarily because of the NCDs. And then for those people who unfortunately have a heart attack or cancer or diabetes at the age of 50 or 60 and then unfortunately die. And as I mentioned before, I think these processes started way early. And as Dr. Kido mentioned, sometimes it started in the childhood dietary habit or smoking habit or drinking habit or stress or social connection. All these things are influencing to the unfortunate death in the middle age. So in that sense, as you pointed out, the disease may appear relatively later in the life, but we strongly believe that the life course actions, while they don't have any symptoms, are very critical to fill this health gap in our region. Thank you.
Thanks.
If I add more, I want to send a message. Previously, the people has a misconception. NCD is a disease of the rich people. NCD is a problem in high-income country, which is not true. If you read the report, NCD indicators in high-income country, in the upper middle-income country is going better. However, we see more premature deaths due to NCD in middle-income country. Within the middle-income country, this is already a very serious issue in working people and not rich people. It is people of the middle income class and the people of the low income class. That's why we urge governments to pay attention, protect your health. It is not matter of the high income people, it is matter of the old people.
Thank you so much. And over here, we've got Luis and Susie who want to say a few final words.
Just few words to put dots together. As you can imagine, responding to all that will mean a lot of workload for the systems, meaning many elderly and young people needing services. But governments or systems needs to be wise. We cannot expect to tackle that at hospitals. That's why one of the main visions of the main strand of the regional director vision is transformative primary healthcare. All this volume of services can only be self-sustainable and equitable if we do it closer to where the people is. And this involves all the points that Dr. Hiromasa was doing on prevention, but all the control. The diabetics and the hypertensive has to be controlled outside hospitals if we want affordable systems.
Thank you, Luis. Susie.
Yeah, just to add to what everyone has already said and enrich the discussion a little bit more. You'll recall many years ago, there was a commission on ending childhood obesity. And the reason behind that was the thinking was that you have to address NCDs at a young age. Now, obesity is actually measured in the under 5 child. It's not a measurement of adults, it's a measurement of the under 5s. And typically, obesity starts in the under 5s when the mother stops breastfeeding and starts introducing new food. So the weaning is not good. And to add to that, when you add on infant formula at a very early stage, you are predisposing children. There are a number of studies to show that commercial infant formula predisposes children to diabetes later on in life. So again, we're going back to the vision, right? This is about families, communities making choices, because in the case of obesity in children, the minute you hit an obesity rate at age 5, then it becomes very difficult to reverse it. So it goes back to very early in life, and it means that governments have to really work at the regulatory environments for products that are harmful for people.
Thanks so much, Susie. Let's just give a final word to the Regional Director, Dr. Piukala, before we wrap up the press conference.
No, I just want to add on, and I think this is a very important issue that has been raised twice on NCDs and obesity. And I think this is not an easy fix. You've had from the director the epidemiological shift, the social and commercial determinants affecting the lifestyle of people. Many countries, it's more than 90% imported food. There's a shift from locally planted healthy food and fishing, healthy food, to processed food. And if we talk about trade, to close that, what is the reality of that? Because for us, for many people, processed food is part of their daily life. So easy. People do not need to get out from their devices. Right now it's just different. You just go home and then people will just stay in the room. Children are staying in the house. They don't go outside. So until we address the social and commercial determinants, this is not an easy fix. Because if this was an easy fix, we would be sitting here discussing this. And some people, maybe like me, will make money from making this an easy choice. So healthy choices should be easy choices, but it's not happening. It's difficult. And I think there's a need, a whole of government, whole of society approaches to address this. And what Susan Megalo has said earlier, the importance of communities, families to make the decision. And I think we can all work together to address these rising tides of NCDs. We have rising sea level. Now is the rising tide of NCDs. And I think this is the only issue that have been raised in this forum twice. So this means it's important. And the risk factors, we address the risk factors, we address NCDs. But the alcohol, smoking, physical activities, other risk factors that we need to address. And I thank all the directors for being here today to answer all the questions that you raised about the report, about the Mpox, about health issues related to our region. And I thank the media, journalists who are joining here in Manila, and those of you who joined online. Thank Mark for joining from Fiji office. And Liv and the team, thank you all for making today's press conference in preparation for our regional committee meeting next week. And we are all excited. We are looking forward for the regional committee and the endorsement of the vision for the region in the next 5 years. So thank you. And looking forward to seeing some of you next week at the regional committee meeting here in Manila. Thank you.
Thank you so much, Dr. Piukala. Thanks to everyone for joining. The whole regional committee next week will be live streamed on our website, on all of our social media platforms. We'll be posting live updates. If you have any questions, follow-up queries, interview requests, don't hesitate to reach out to me or one of my colleagues. We'd be happy to help you. Thank you very much.